One greetings from the high 10. It's Everyday Shenanigans. Thanks for joining me. This is live number 2. This subject matter is pertaining to sex reassignment surgery. Should it be illegal? As you know, Roe versus Wade has gone before the Supreme Court, and now in most states, an abortion will be illegal. So I asked the question a few weeks ago, what else will be on the chopping block? So the subject matter came up of same-sex marriage. Do you think same-sex marriage should be illegal? Same-sex adoption? And now, sex reassignment. Should it remain legal with children and adults? That's a set of information. My first source of information is coming from the TLC network. A young lady by the name of Jazz prepared for bottom changing surgery. She was once a male and is now a female. And I'm going to take you on her journey briefly pertaining to the surgery and the ramifications of getting the surgery. Because the one thing many people don't think about is what happens afterwards when you have the surgery. Are you satisfied with the results? Are there complications? Will you ever have feeling down there to be able to feel and or participate in sexual activity? Because that kind of defeats the purpose of getting the surgery. Let's be truthful. You may say, well, I identify with this sex, the opposite sex. Then you get the surgery, and you may like what you see down there, but it doesn't work. Stay woke. And I think you hear more ramifications of men transforming into females having complications. Okay? Having complications. What was once a guy is now a female, a resemblance of a female organ, but it has no feeling. It doesn't work. It's complications. Can't urinate. Who wants to have an organ and you can't urinate? See, people don't think about that when they're wanting to look like the opposite sex. What is it going to be like once I get this newly constructed body part and it doesn't work, it doesn't function? And what is the purpose of having it if, hey, you can't do anything with it? I'll just keep it real now. We're all grown. Is a penis able to penetrate this newly revised version of a penis now into a vagina? Let's ask all the pertinent questions. Jazz is my first topic. TLC is the source. Thank you for joining me. This is Everyday Shenanigans.
Hey guys, who's hungry?
I'm hungry.
This is Jazz's last meal before the prep, so I wouldn't be eating too much.
We're on the eve of Jazz having her major surgery, and it's really just a moment in time that we're really never going to recapture. And I just know that the next time we celebrate anything, it's just going to be different.
Who wants fried green tomatoes? Did anybody order that?
I ordered 3 of them.
So Jazz, artist-wise, have this vision in your mind, the most beautiful vagina that was ever created?
I don't need it to be beautiful. I just don't want it to be crazy ugly. My biggest concern is that I'm not gonna be happy with the results. I'm worried that I'm gonna be like, this is ugly.
Yeah, but aren't you happier with that than what you have now?
Yeah, of course. I just know, like, I kind of have an artist's eye. So if I see something crooked, I'm gonna be like, that's crooked. This looks weird. What is this?
I feel like there's no real vagina. There's like, oh, this is the vagina. Like everyone's just different. And I feel like no matter what, it's going to be fine because she's going to just have a vagina at the end of the day. And that's all she's wanted.
How about I show you mine? And then you can just...
I don't think I've ever had a conversation with another woman about how beautiful my vagina is over her vagina.
It's not about other people looking at it. It's about me and my feelings. It's my body, you know?
Absolutely.
I'm looking forward to the day where Jazz's vagina isn't always the main topic of discussion. I hope one day it's just natural that Jazz has a vagina and we're just all happy for her.
Well, we haven't really discussed the emotional aspects surrounding everything.
I'm not going to sit here and sugarcoat the fact that she has depression. She has it. We have to always be aware of that. I certainly hope that after the surgery, she'll be happier. She suffers from depression, and maybe some of this depression will be alleviated
perhaps she will overall just be a happier person and have less of the blues. You know, crossing fingers and toes that it works out that way, but there's no guarantee.
Like, are you going to be okay afterwards? Not your body, but your mindset. You know, are you going to feel like depressed? Why do you think I would feel depressed? Because you already suffer from depression, and now they say that a lot of people can be depressed afterwards, and it's going to change your dynamic. Your hormonal dynamic is going to be different. We don't know till it happens, honestly.
I know her hormones are going to be fiddled with now, and it is common for people that have this surgery to be depressed afterwards. And what about somebody that already has depression? So it's a major concern of mine.
And I'm worried about how you're going to be. I don't know if after the surgery, I could come out of the surgery as a totally different person, like I said, or I could come out as the same Jazz, just with a new body part.
If Jazz is feeling good about herself, then I will be euphoric. If Jazz is down in the dumps, it's going to break my heart.
I'm really just not overthinking it at all.
Good, then you shouldn't. Go with it. I don't think surgery is a total panacea for Jazz. I think it's the missing link that will make her feel more complete. Will it solve all her problems? Will it immediately snap her into being singing in the rain and carrying on and joyous and never being moody again and depressed? Because who is that? Who is anybody that way?
Hi. How are you?
I'm good. How are you?
That was the grandmother speaking.
So I am your transgender anesthesiologist.
Awesome.
And my first name is Nick. So Dr. Nick or Dr. Hurt.
How lucky are we to have these incredible doctors, who know what the trans experience is about and know what Jazz is feeling, to be in the room with her? I mean, that's positive energy, and I know she believes in that. So this is good mojo for Jazz.
When I was 2 years old, I had a dream of the good fairy coming to change my penis into a vagina. And today that's finally happening, and I feel like, you know, Dr. Marcy Bowers is the good fairy, and now my dream is coming true.
No, I am not nostalgic about Jazz getting a wish for a vagina. She wanted that good fairy to come so many years ago. And I think inside me, if I could have waved the wand and gotten it for her, even earlier, so that she didn't have to sweat out not having the normal adolescence, I would have.
There are no words to describe how incredible this moment is. I feel like I have been envisioning this day my entire life, and now it is finally happening, and it is just so surreal that it's all occurring right here, right now. Now it's time.
You'll do great, Chase. Love you.
Love you, Dad. I'm just overwhelmed that it's happening. I just don't want her to see me like this. But this is a huge thing. But she waited for so long, and it's here, and I'm just happy for her. Feels like a dream.
Yeah, coming true.
Coming
true.
It's been a long, long journey, and there's been a lot of things that have gone on to get to this point.
The boy for sure.
We're gonna keep it real, guys.
Jazz always just gravitated towards girly things, wearing my shoes, my little slippers.
I was like most people, we would think, is that it was just a passing phase.
I have a girl brain and a boy body, and I think like a girl, but I have a boy body.
And I do feel like there's been a lot of bumps in the road.
Doesn't that make her into a freak?
You may as well kill yourself back where I come from and trying to date in school in your condition.
That kid it's a male. It's disgusting.
I wish I could take some of this away. I wish she could just be.
We're at a key point in the journey. She's a whole person already. This is just something that she's always wanted.
This is Jazz's journey.
The search for American top vagina.
Where we're gonna give kisses and hugs.
Love you. Love you. High five.
Be strong there, right?
Yeah.
You don't need to tell her that. She's gonna be. I've always thought of Jazz as my sister, and I've always loved Jazz as if she's my sister. And it's just gonna feel really good to see her happy and to see how happy she can be now that she finally has the body that matches her brain.
All right, that's Griffin speaking. He's a brother. And as he said in the commentary, it'd be nice not to hear it as, I guess, dinner table talk, because naturally he's a male and guys are funny about certain type of topics dealing with women, men issues. And it is helpful to have a supportive family that can relate, have empathy for what you are going through. I'm going to play you another video pertaining to Jazz's journey. There is a TV show pertaining to this journey. It's on TLC. I Am Jazz. Has 5 seasons, starting in 2019. Are some of you in agreement with the sexual reassignment surgery? Are there some of you that disagree? As you heard commentary being played, they were at a radio station doing an interview, and some men called in, not in agreement that you're a male. Regardless of what you do to the penis, you're a guy. You'll always be a guy. Doesn't matter. And I don't know if some of you have seen the reconstruction of a male penis into an alleged vagina. It is not a pretty sight because naturally all penises are not alike when they're whole. So naturally they wouldn't all look the same being reconstructed into a vagina. And I've seen a photograph surgery on YouTube many moons ago, and I did not like what I saw. And why would I like it? Because it's not a vagina. It's a penis being cut into a vagina. That's the best way I can word it. And the thing that a person is not thinking about, the guy who's wanting to be a woman, it's that you don't know if you're going to have feeling in that organ. And you're taking a perfectly working organ that you can't identify with, that you don't like looking at, and trying to resemble it into a vagina. And God forbid, after you have the surgery, it does not work. You have no feeling there. You have complications down there. And that's what you're going to hear in the next commentary pertaining to Jazz. Thank you for joining me. This is Everyday Shenanigans. I want to try to get the next videos, two more to play pertaining to Jazz, short videos. And then I'm going to play a commentary of a young transgender person out of the UK. And they are going to give their commentary, how they made a grave mistake by going forward with the transformation. See, that's the thing about it. You don't know what's going to happen afterwards. You just know that you don't like looking at it, but you don't have any idea what it's going to be like afterwards. Gender surgery gone wrong. I might never experience an orgasm. I Am Jazz. TLC Australia is the source. Thank you so much for joining me and patronizing the channel. If you want to donate to the channel, $sign Beganji129. Cash App. All super chats and stickers are welcome during this live. And thank you, new subscribers and visitors to the channel. Hello, Big Will. Hope you're listening. Big Will Auto. If you need a car, check out Big Will Auto out of Maryville, Tennessee. Amen. Thank you all so much for joining me.
Dr. Bowers and Dr. Ting photos, but it's been a little while now since they've last examined me in person. So I think it's going to be really good for them to look at everything and get a game plan on about how they're going to perform this operation.
I feel like we're near the end of the journey at this point. And I do feel like this is going to be the one where they're going to say, this is what we got to do to finish everything up, complete the process, and let Jazz go on her merry way.
Hello, knock knock.
Hello. What's up?
How we doing?
How's my wonderful family? Good to see you. Jazz has had a very difficult surgical course. She had a very incredible first surgery. It went seemingly very well, but there were problems. And that prompted a second surgery, which I was not a part of, unfortunately. Yeah, this has been a real journey, hasn't it? You know, We knew it would be tough. It turned out tougher than any of us imagined.
Taking Jazz on as a patient for surgery, we knew it was going to be a one-of-a-kind surgery. She's one of the first to have undergone complete tubercle suppression and lack of growth of the skin and other tissues, which we rely on as surgeons to do this operation. And we don't have the experience of having said we've done 50 of these. I was just not expecting her to have a complication as severe as
Very interesting information. Haven't done enough of
I think in
them.
hindsight, we would have never sent you home
Not
from the
good.
hospital. You know, easy to say now.
Mhm.
Yeah. When I wasn't here, when you had problems and had to go back,
Mhm.
I can't tell you how stressful that was.
Under the circumstances, do you think it was important to you for a little mea culpa?
I'm not sure. You know, it's nice to hear I did something, acknowledging that. On the other hand, there's the medical side and an expectation that really should have been met.
Can we take a look?
Yes,
Can we examine
let's do the
you?
examination.
Okay, so we'll let you change.
We're not doctors, but we've had a chance to actually view what went on in the OR during Jazz's first surgery, and it's pretty disconcerting in certain ways. It's like, whoa, you know, this is what occurs while Jazz is having her surgery, and the doctors sometimes don't see eye to eye.
Why are you cutting there?
Right here?
Yeah, why?
Because it's scar, Jess. I don't like it.
Yeah, but there's scar everywhere. If you don't have to
Okay.
cut this, why would you cut that? We could just advance it to there.
Jess, let me go.
But it doesn't make any sense to cut that.
Because this is a disfiguring scar.
How do you know it's not a disfiguring scar? That's just a sulcus. These are the two labia. I mean, you may be right, but we don't know.
Jess,
Why don't we just open this up and then see what this
let me
looks
go,
like?
Jess. Let me go.
I will say that I feel like things should happen in a more methodical way.
This needs to advance more because we're
And
off center.
this has to come down here.
I mean, this is off center. See, this is tilted. So that in order to get this midline, we need to bring that down more, and that will centralize this.
I think we're saying the same thing. I'm happy. I have a good sense of what we need to do. Let me just take a picture too. Poor thing, you could be a porn star for all the photos are taken. God, I'm so sorry. I did not say
We
that.
have to just keep joking around here, otherwise we don't get through.
Right. God knows, if we didn't laugh in the last 6 months, we wouldn't have made
So
it.
get dressed again.
You get dressed again. I am happy she has feeling in the area and the tissues have matured very nicely. But I have some concern that we can get enough mobility of the tissues that we can make the labial structures look convincing.
Now that you've seen it, do you feel good?
Feel good. The only problem is there's a limited amount of skin,
Mm-hmm.
but these scars now will make them better and nearer. We won't make new scars.
And I know you hate scars, I know.
I hate scars, yeah.
So last time the major complication was dehiscence, the
Right.
stitches started coming apart. How likely do you think that's gonna happen again?
It's always possible. I have optimism that it won't need another surgery. Just
This will be the
based on
last one.
this will be the last one, but there's a certain amount of just uncertainty that you just have to account for.
Mm-hmm.
Okay.
I wanted to know, will I lose any sort of sensation there, nerve endings? I don't know.
There is always a chance that there could be injury to the clitoris.
Yeah, that's
I'm just gonna ask
that's the
about that.
biggest thing I'm worried about. I feel like I've already lost the aesthetics. You know, hopefully after this revision, it'll look good once it heals. But if I lose some of my sensation and nerve endings, I might never experience an orgasm.
I guess it's goodbye time until tomorrow.
Until tomorrow.
Okay, one more hug.
I'm feeling pretty confident that they're gonna pull it off and that tomorrow's surgery will be good enough and that I'll be happy with the results. So I'm hoping for the best and that this will be the last operation. To be continued.
All right, everybody. That's the second video. Trying to get this mess out of here. Excuse me. Let's talk about that for just a second. Feelings, nerve endings. Well, it's a possibility because you're cutting into a vital organ. Any type of surgery you have, there's a chance in the area where you're being cut that there will be no feeling afterwards. Days, weeks, even years. feeling can come back at some time, but it's up to your body to decide if it wants to give you feeling in that area. You have to ask the ultimate question. Is Jazz satisfied with the result? Because now you hear in this commentary, they were on surgery number 2. Sutures came open. The body appeared to be healing, but that's only one night. By the next night, no. T, make sure you've blocked out those spams, please, because I tried. It said error. I don't know if you did it already. Thank you all so much for joining me. Let's go to the next set of commentary. This will be number 3. Jazz gets rushed back into hospital for an emergency examination. TLC is the source.
I don't really know how to pee. It's the same thing, Jazz. Just push. Run some water, but that always helps. I don't know, nothing's really coming out. Mom, can you come help me? I need new gauze and a new pad.
Welcome to womanhood.
I don't know what to do. That's barely any blood. No, look at all this.
That's nothing. You should see when you get your period. When Jazz was little, I helped her with her diapers. She's not quite in diapers now, but it's all bodily functions. Never thought I'd be here again, but there I am. I'm still her mommy. No, that does not go in. Women do not throw pads in the toilet.
Oh.
Yeah.
Okay.
How'd that go? That was a fail.
It was a fail.
But she learned that you can't throw sanitary napkins in the toilet.
When you watch this video, you'll see her waddling out of the restroom, obviously uncomfortable, wearing a pad between her legs. Never had to wear a pad. And I doubt that there'll be any blood flowing out that is the natural blood that comes from a woman, because it is still a male body, just transformed a body part into an alleged vagina. But there's no way I can believe that a man is going to have a cycle, because his body wasn't designed to have a menstrual period. It's very interesting information. Exactly. Well, we know that, Bambi. We know that you can't have that. Blood is naturally coming from the sutures being open. Very interesting information. As you can see, the brothers in the room, hospital room, hotel room, listening like, dear Lord, what am I listening to? But he's a brother. He's supportive. But you also have to think about that side, too, as being a male, or the brothers and sisters listening to this conversation often. It can become daunting. And it's not to be mean, but just hearing it a lot and all the time. That would get old, I'm sure. Thank you all so much for joining me.
How you feeling? Want me to come over there, cuddle? So I'm going to send this picture that I just took over to him and to Varsity. Yesterday, Jazz was getting progressively upset because her wounds were definitely separating, and she formed like a blister, like it's almost like a blood blister. I sent a picture to Dr. Ting, Dr. Bowers, and he's going to make a decision right now if she's going to go back in the OR or not. I'm just like freaking out. I don't even know. So many mixed feelings. I'm like, this is not happening. Maybe I should take your temperature. You might ask if you have a fever.
This is basically like my worst nightmare. The surgery was just going so excellent and the recovery process was perfect. And now all of a sudden, overnight, my vagina just like changed. And now it's something completely different.
What did they say? Oh, he's coming here.
He's coming here?
I am shaking inside. For him to come over based on a photo that I sent him, what does this mean? I'm really petrified. Good morning.
Hey.
Okay. She took a shower, she changed her clothes.
was a little surprised. Jazz is young and healthy, and normally patients like that heal really quickly. But instead, it just looked like the sutures were starting to spread, and the color of the skin right along the edge of the wound, you want it to be nice and pink, but it was looking dusky, kind of bluish, which can be a sign of too much tension, there not being enough blood supply. So I was pretty worried at that point. She's separated a little bit on both sides, which again, we did kind of know was a possibility, that there wasn't a lot of skin. So I'm just worried that everything here is under a lot of tension. I don't want, that last stitch to pop and then everything will just go, like a window shade. Plus the way it just sort of rapidly got worse over the course of one day. I was like, oh, maybe we should just intervene early. Taking me to the OR will allow us to take a good look on the inside, really see what's going on. There's good lighting, we have good instruments. As the incision opens, it can pull the entire graft from inside the vagina out, and then we would lose her vaginal cavity. So we need to intervene to do something. Skin graft, we suture it, something.
Does she stay overnight in the hospital tonight? Would it be several nights or just the one night?
Maybe a couple of nights. We'll just see how she's doing.
I should pack up.
I'll pack up.
I feel dizzy, lightheaded, nauseous, and sad. I hate to use the word nightmare, so I'm not going to say it's a nightmare, but this is so far from anything I ever imagined. This is not where she thought she would be at this point. Okay? Hands are cold. Love you.
Love you too. I'm just thinking about when we first came to this hospital, how happy and excited I was.
You got this. You got this. Okay? You're the strongest, bravest person I know. You're gonna get through this. It's gonna be okay. Just want to say goodbye to her? Yes. Okay. Love you. Okay. Bye. Love you. Okay. See you. You're in good hands.
Take good care of her.
I know. Trust you 100%. My room.
Sure.
I'll keep you updated. Okay, thank you.
TLC is the source. Let's chop up what's been said in this commentary. Video number 3. Jazz was rushed back to the hospital because of sutures. The disturbing part of this story, depending on how you want to weigh the commentary, is the fact that this child wanted to be a girl as a young boy. The parents sign off on the surgery later down the road and has complications. One of the surgeons is actually a transgender himself. He's sitting there as a woman, blonde-haired woman with glasses. The other doctor's Asian surgeon. And the other disturbing part about this, besides having now transgender doctor, was the doctor certified in what he or she was supposed to be doing appropriately. They're arguing back and forth during filming of cutting the said organ. I would have been mortified to be in the room as a family member, parent, and hear these two bickering about where to cut and leaving scars, That was disturbing to me because I'm looking at my child under the knife thinking, wait a minute, you all picked a fine time to have a difference of opinion while cutting someone open and trying to make it look like a vagina. Let's keep it real. So the Asian doctor is, male doctor is in refute to the transgender doctor incision making. This was bad, real bad. And now you have to ask yourself, how many times has this gone on in the operating room? Somebody else is alongside the surgeon, main surgeon, saying, no, don't cut there. No, why are you doing that? And there's an actual camera there filming. Now imagine Jazz watching that, woke, and watching the video after the fact. Like, wait a minute, you all weren't even in agreement on where to cut me? And naturally, you're going to have scarring. You're going to have scarring, of course. So I can see why the other doctor was saying to the transgender doctor, well, there's going to be scarring. I mean, what is your problem? It's got to heal once we sew her up. The body has to be able to heal. There will be some scarring. That's just what comes with being cut on. Very disturbing. Very disturbing. And I don't know if that was from, the scarring is from surgery number 1 that he was trying to go over, but it's scary. And indeed, are these the same surgeons that performed surgery number 1? I tried looking in the queue for update, and I couldn't find anything. And then I just realized there's this 5 seasons of this, so I possibly need to go into the 5th season to see how well Jazz fared after the fact. But it's scary nonetheless, because as I said, you're trying to conform a male body part into a woman body part and expecting it to function. That's first and foremost. The ramifications afterwards, such as the sutures not staying open, being numb, not getting any feeling down there, the organ working properly, such as a vagina, as most of you know who are women, that is where we urinate. So will you be able to use the restroom properly? It's common sense. And you hear her in this commentary saying to the mother, I need some help. She needed help putting the pad on, of course, which is not going to be menstrual flow blood. It was just, blood from the sutures. But nonetheless, she couldn't even urinate, because maybe the body is saying, well, I don't know how to urinate out of this because this isn't your penis. Just saying. My last commentary is going to be pertaining to a transgender out of the UK. This was once a male turned female. And they did not have a good ending to their liking of the surgery. And I want to say this about Jazz. Very supportive family. Kudos to them for being there for what was once a boy child turned into a female. And a lot of people don't have that result from their family, that supportive moral support, physical support. But imagine having a child, a boy, and you're looking at your boy act like a girl, wanting girl things, wanting to do girl things, wanting to dress like a girl. And perhaps you wanted a boy, but you're now looking at your boy act like a girl. Can you imagine what that would be like for a parents? Because in this case, we're talking about some very understanding people. Very understanding family. But as I said, there are many people, children growing up, they do not and did not have understanding parents that identified with them wanting to be the opposite sex, mimicking the opposite sex. So here you have a little boy putting on mommy's shoes and jewelry and accessories, and she ran with it. And you heard the boy child speak in the beginning as a child on video. I'm like a girl. I identify with the girl. He was a small child then when he spoke those words. He knew he was a boy, but he basically told the camera, I am a girl. I want to be a girl. So imagine having a child and your child is telling you this. I want to be the opposite sex. And then imagine you can't identify with that. That's why I said this child is fortunate to have understanding parents. Now imagine parents who are not understanding, and they're going to tell their child, no, you're not going to be no girl. You a boy, and you're going to act like a boy. And I'm going to continue to dress you like a boy until you leave my house. Imagine that dynamic. And I'm sure that dynamic has transpired in many American households where the child didn't get the luxury of putting on little girl dresses and shoes and hair bows because the parents said you're a boy and I'm going to dress you like a boy. You're going to act like a boy until you leave my house. Vice versa. Girls identifying with being a boy. And to each degree, it's cruel to be a child and wanting to be the opposite sex, but you can't because that wasn't designed for you. And now you have parents who say, hey, I'm not on board with this. And we can also chop that up as well. How do you feel about allowing your child to dress as the opposite sex, even give the child a feminine and or masculine name? Because there are people who are doing that. They're allowing their children to be the opposite sex, changing their name. And see, a lot comes with that because you have to talk about birth certificate, ID, all of that, Social Security card. You'd have to get all that changed. And I'm sure there would be some legal wranglings in trying to do all that after the fact. Thank you for joining me. This is Everyday Shenanigans. Okay, let's go back, and I'm going to pull up another commentary of a transgender person who's going to give their commentary pertaining to their decision to change their sex. And I have read and watched videos of people who realize they made a mistake by trying to change their sexual orientation and they were not pleased with the results. And that is the thing about this. You can't go back. Ruby Fiera has a YouTube channel, Sex Reassignment Surgery, Regrets and Problems. Inside this video, you will see what appears to be a Caucasian female with red hair, but naturally she was a male before changing over. Ruby Fiera. Thank you all so much.
Hello you lovely people, welcome back to my channel. So today I'm making a video that I've been meaning to make for a very long time. However, I haven't had the strength to do so. For me personally, if ever I'm dealing with something, I usually just kind of shut down and go into myself, and it's only when I come out the other side feeling much better that I feel strong enough to talk about it. So I didn't want to come on here. I tried, I couldn't. But I wanted to make this video now because in a couple of days I will be having revisions of my sex reassignment surgery. So, as you know, I've documented most of my journey on here, my recovery, the hospital process, everything. However, I encountered a few problems later on in the recovery that have led to me now needing revision surgery. Around the 6-month mark, the scar tissue inside my vagina started to contract and go fibrous. So instead of it being stretchy, elastic skin, it started to feel a lot more like cartilage, that kind of feeling. And my vagina started to contract and get incredibly tight, and it made dilation painful and prevented me using the larger sized dilators. No matter how much force I applied, it was just so tough and painful, and just no matter what I did, relaxation and easing up slowly, there was just no stretching at all. There was no give absolutely at all. So because of this, I lost quite a lot of depth and led to a massive decline in mental health. I noticed that there was a bit of residual erectile tissue in my urethra, which was a little bit too large anyway. So if ever I became aroused, it would swell up quite a lot, go bright red, and was quite painful and unsightly. Just in general wasn't that great. The size of my urethra also, the entrance to it, was a bit too big. So if ever I was rushing to get a finger in, I might accidentally go up the wrong hole, and that's incredibly painful, especially when you've got a sore bit of urethra anyway. So due to the general size of it and also the exposed portion, it's led to recurrent UTIs and despite drinking.
Right here where she's speaking of the finger going up, I don't really know what that means. I don't think I want to know. I don't know if she means somebody trying to penetrate her or she's checking something. I'm not really sure what that means. But anyway, it does not sound good. Let's just say that for the record.
Cranberry juice and cleaning and drinking lots of water, it's actually led to me having 3 quite bad kidney infections, which the pain of that is quite incredible. And I'm just really fed up of it. I've got quite large labia majora, which I've had comments that that's nice. We like a juicy puss. However, I get quite a bad camel toe in pretty much anything I wear, which at first had a bit of a novelty, but now I'm becoming a little bit self-conscious of, especially when I'm not intending to have a camel toe. So I'll be wearing jeans, leggings, just out and about, and I feel it draws attention to that area, which previously, if people were looking at my kind of crotch area, the dysphoria would massively kick in and I feel like I was going to be clocked and all of that. So when people are kind of like noticing my camel toe, it's a little bit, it throws me back to that negative mindset, which isn't great. And it's put me off wearing certain things like before surgery. And I went to the beach for the first time and wore a bikini and it pretty much ate it. So not ideal at all. So I would like to reduce the size of my labia. Yeah, another issue because of this is that because there's a lot of skin, I get almost like dermatitis or a rash, that kind of thing in the creases. And no matter how much I clean it or dry it after anything, it gets very sore, very easily irritated, and just all round not very pleasant. So I'm hoping that this will sort it out. So all of these have kind of amalgamated into making me quite depressed, as you can imagine. And after going through all of this, all of the surgical trauma, all of the laborious recovery, for it now to not be as I want and for it to be causing me pain, which obviously my penis never caused me physical pain. My vagina now, not only is it causing me physical pain, but obviously there's a bit of mental not liking it because of obviously the appearance of the bits that shouldn't be there, blah, 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 blah. It's made me almost regret it. And I'm not saying that I regret having the surgery at all. It's the best thing I've ever done. It saved my life. I would never change that for the world. However, when everything is starting to go wrong and the negatives are outweighing the positives, you start to feel feelings of regret. And it really, really gets you down mentally. If it's affecting my relationship, it's affecting my work life. So just generally my whole life is being negatively impacted by my vagina currently. So I've been to my surgeon and he said, absolutely, we can fix all of these issues for you. So I've been booked in for revisions, which will be happening in 3 days' time, which I'm incredibly excited for. I've got very high expectations, but fingers crossed everything goes perfectly. He said it's simple, just there's a couple of nips and tucks and just physically stretching me out from the inside, which he can do with a lot more force and skill whilst I'm anaesthetised than me trying to do it to myself, which will be good. So very, very positive outlook on that, which has given me the motivation and just positive feelings to be able to make this video today. I just wanted to share my experiences to help anyone else, basically. So that's about it. I will keep you updated with my revisions, and yeah, I'll just film the process as I've done before. So thank you for joining me today. If you've liked the video, make sure to like, comment and subscribe, and I will see you in the next one.
That's Ruby Fiera. Let's read some of the commentary pertaining to what was said in this video. I personally do not do well hearing about things like this. I cannot imagine going through it. I had a cyst removed from my genital area surgically, and it was painful as F when I woke up. But all I had to do was heal after. I cannot imagine this at all. I do hope all is well for you. We are all humans created from the Creator and deserve love. To you. That's by Roberta Pascal. I'm just going through some. A lot of people just apologizing for what Ruby has gone through. One person saying you inspired me watching some TikTok videos. So far, I haven't seen anything negative. Let me go to her channel to see if there's anything else of an update. Thank you all so much for joining me. Well, she's been on a dinner date 12 hours ago, so let's see. Had vocal and breast surgery a year ago. Let's see what she has to say.
Dispense supplements virtually.
Sorry about that. 4 years with a vagina, life after revision surgery. If you need verification, this is in the YouTube queue. Ruby Fiera is the channel. Thank you all so much for joining me. Let's see what she has to say.
As you know, I've been gone a very long time, and you've been waiting for the update of my revision surgery for my sex-reassignment surgery. And I've been wanting to make this video. However, I also wanted to give it some time to not only deal with my mental health following the surgeries, but also give it enough time to get some life experience and make sure that there aren't going to be any other complications that are going to arise through the recovery and just general living before I make this video. So here I am today. It's been a year and a half. I think that I haven't had any changes in quite a while, so I'm pretty sure it is how it's going to be now forever. So I'm here to make this video. So as you know, I went under the knife for a second time to correct some issues that I had following my first surgery. I'll just list them really. So I had my labia reduced because they were rather large, and not an issue, not that there's anything wrong with large labia, but for me, I wanted them to be a little bit smaller cosmetically. And I had some excess erectile tissue surrounding my urethra, which was a bit uncomfortable when I became aroused, and visually wasn't the best. So I had that removed. And
I can only imagine what it looked like. Oh my gosh.
The biggest concern for me was forcefully dilating the scar tissue internally that had kind of contracted and had caused me to lose quite a lot of depth, which obviously after spending months and months of dilation and being in pain to try and make it heal how I wanted to was devastating, that I'd then lost depth and wasn't quite how I wanted it to be functionally. And unfortunately, despite him trying his best, he didn't want to do any more than he did because he was worried that it would cause more harm than good by forcefully trying to stretch scar tissue internally. So when I woke up, he told me that all of the things that I previously mentioned he could fix, but the depth and the tightness he couldn't really fix. So that took a while for me to deal with mentally, because obviously I've gone through this quite traumatic experience to then have it not as I wanted it to be. So, like I mentioned in my previous video, there was a lot of regret, but not that I've obviously gone through the surgery, but the pain that it caused and the mental anguish caused me to have regrets, and that is obviously human. There was nothing wrong with my penis. It just wasn't my penis. I didn't want to have a penis. So despite all of these issues that I've had, I would rather be where I am now than where I was. However, through sheer determination and possibly my job being what it is, through the year and a half that I've been living with it, I have been able to stretch it to the point where I can quite comfortably fit a decent size object. Oh God, demonetized. So it's functional to the point where I can have sex and use toys and be totally happy in myself with it functionally. Which it just took a lot of time. It took a lot of time, slow, relaxing, bit of force, but I'm there with it. So luckily for me, that issue is now being fixed. So on the whole, it is how I want it to be. The journey was nowhere near what I expected it to be. It has been hell. The 2 years of being in constant pain with my urethral issues, the kidney infections wasn't nice. The dilation wasn't nice. But now I don't feel any pain unless I go a bit too hard, which that's my own doing. But that's normal. And it's to the point now where I can have sex with someone and not need to tell them that I've had any surgery because they won't be able to tell.
Wow, interesting.
Obviously, under really close inspection, you can see faintly my scars. They're doing amazingly, pretty much disappearing, which is brilliant. But again, with what I do for...
Let's stop right there because I'm not trying to play all the video. Please go to my community board. I'll share it there. 2 years of UTIs, complications. That's a long time to be in pain in your private area. Okay? I don't care what you're going through, whether it's reconstructed or not. It's just your private area. You need it to function, to work. You want it to be functionable. But naturally, this person had surgery, so you had it formed into what is believed to be a vagina. So there were complications. And I can't imagine, as I said, 2 years of a non-functioning body organ. Now, this video was uploaded 2 months ago. It's been 4 years, the entire surgery. Second surgery was to correct the issues that happened with surgery number 1. So Ruby now is able to have sexual relations with a said penis and devices. Shut your mouth, Queen. But what I'd like to know is the obvious question. Would she be able to conform to a very well-endowed male? Just ask. I think most people would be kind of curious. Because I think I'd be kind of scared. Just saying, with all the problems you've had in the past, having sexual relations with a very well-endowed man, would that cause a problem? Because you have to remember, this is not a normal organ. And even a woman could have complications from having sexual relations with a very well-endowed man, especially if a man is very forceful during sex. We're all adults. Please let everybody be an adult watching this live. Thank you so much. I can't picture it. I can't. Because when you hear her talking about the swelling and this and that and the swelling of the erectile tissue near the urethra, my stomach is flipping right now. And basically said it didn't look good. So that means your body was still functioning as a penis. So when the penis became aroused before it, it balloons up, because that is what the organ is supposed to do. Now it's ballooning up, but not in the capacity it was supposed to, because it's now been cut on. I'm dead. Lord, I need a breather. Very interesting information. Ruby Fiera, if you want to check out that said channel, feel free to hit the link if you want to give your opinion. I only have a few people viewing this live. I'm going to do one more live this evening, and I'm praying I get a good feedback from that third live, which will be pertaining to the childish man. I think we need to chop that up. It's time for the queen to go back to her old commentary of talking about various subject matters, and men will be topic number 3 for the evening. Thank you so much for joining me. I played your information pertaining to a Jazz who always wanted to be a girl as a boy child, finally got the surgery. Very supportive family, but had complications. 5 seasons of that said show, I Am Jazz, ran on TLC. Here you have a Ruby Fiera out of the UK discussing the transformation of the body part. Should it be legal? Because Lisa in the chat is saying she would have signed on for a child to have the surgery. And I don't think a child should ever have this type of surgery. So I'm going to say in my own opinion, I do not agree with sexual reassignment for a child, because let the child grow up into an adult and let he or she decide what they want to do with their body part. Because in the end, they should be the one that stands account for what's done, and not saying, Mommy, Daddy, I don't like the way I look down here. I want it changed. Wait till you're an adult, and then you can make the decision for yourself. And if there are any regrets, ramifications, you will have to stand account for the choices that you made with your own body. I, as a parent, wouldn't sign off to get my baby's body changed because he or she can't identify with their bodily organ. Because God did make you that way, whether you like it or not. That is the organ he gave you. My thing is it worth it? Besides legal ramifications, it is legal, but should it be legal? And then there's the ramifications of getting your body cut on. See, the body wasn't designed to be cut on. It doesn't matter what's inside that's not right, such as real health problems, such as cancer, tumors, cysts. The body isn't designed for the cutting. I think that's obvious, because you've heard of the horror stories of surgeries gone wrong, surgery's gone right, but the body said, I don't like this. I don't like what you did to me. And it could be you needed to have the surgery. You could have broke your nose or sprained an ankle or whatever. Or there's a cancer, there's a tumor. But the body is saying, nah, I ain't in agreement with this. Okay, thank you, Annette. Thank you so much for joining us. Welcome all visitors and new subscribers. Amen. See, you can weigh this topic 1,000 ways, just like any topic. But as the country is transforming and changing, people's ideas and ways are changing. Some people are still old school ways of man and woman with children, rearing children to stay in their sexual identities. But then we have people who are living different lifestyles. Man and man, woman and woman, man and man raising children, man and man adopting children. Some of you agree, some of you don't. But with this Roe versus Wade, I said, what else will be on the chopping block for the Supreme Court? What other topic will come forward that Americans will say, we don't want that. We're not in agreement of that. We believe in man and woman. We believe in man and woman raising children, or a man raising a child by himself, or a woman raising a child by herself. But no, not with a gal, not with a wife. No. So will that be the next topic that'll go before the Supreme Court? Clarence is saying, no, we're not worrying about that. But who's to say that a year or two from now, somebody decides to say, we don't want 2 men raising children. We don't want 2 women raising and adopting children. No. It needs to be a woman and a man, or a single parent adopting kids. Will that be the next subject matter to go before the Supreme Court? And also this subject here, sex reassignment. Will somebody decide to say this is wrong, it's morally wrong, you have no business cutting on a person's body, trying to conform a penis into a vagina? And as I've told you all in commentary that I've seen on YouTube, it ain't pretty. The one I saw, let me say that. Because naturally every penis is not the same when it's whole, and it definitely ain't going to be the same when it's conformed into what is to be allegedly a vagina. I have to say allegedly because it's not a vagina. and you may not like what I'm saying. That's my opinion. It's not a vagina. It's a configuration to mimic a vagina. And that is the reason why there are complications, because the penis wasn't meant to be sliced in two and conformed into a vagina. It's hard for me to even say it because it's hard to even fathom somebody letting someone cut their wee-wee. The thought of somebody cutting it or cutting it off because they're angry with you. Remember Lorena Bobbitt? Need we go there? Okay. He's lucky they found the penis. Stay woke, everybody in the chat. Stay woke. And they reattached that penis back to the owner. Had a slight bump in it. Don't ask the queen how she knows. Just use your imagination. But that's the point. What if they had not even found the penis to put it back? What if they had not found his penis? That would have been a man without an organ. Shut up. And how would he have been able to use the restroom with a partial penis? I don't want to know. And I don't know if I even want to Google to find out. But nonetheless, is it morally wrong to slice a penis and reconfigure it? And let me tell you, as a woman, there is nothing like a grown man's anatomy. Shut your mouth. It is a beautiful thing. God knew what he was doing when he designed the human body. Let me tell you, either for the woman and for the man. He had an intricate design, and he meant for that organ to go into the woman's organ. He knew. Shut your mouth, he knew. So in my mind, when I think of that, in the beginning, in the garden, this is what he wanted. Why in the world would somebody want to risk going under the knife to get it conformed? Then there's the flip side of a woman wanting to be a man and getting something done. So you got to have something to make something. So it's easy for the man to take his penis and try to conform it into a vagina, but there's not enough flesh for a woman to configure her vagina into a penis. How in God's name could you? Because we already know what's inside of the penis. You can look and use your imagination. It's got veins and gristle and this and that. And how in the world could a woman's vagina ever be conformed into a penis? You have to be a mad scientist and artist to conform a vagina into a penis. Yes, Annette. It is a beautiful organ, the male penis. I don't have to give a personal testimony. I think we all know we're all grown. It's a beautiful organ. Just like I'm sure men would say the same about a vagina. It's a beautiful organ. And I wondered that while Ruby was talking. Is she growing pubic hair down there to hide the scarring of what is now a vagina? Has she been with a partner that's looked and said, nah, this don't look like a vagina? And when she said she had relationship problems, I wondered, was she with a man or a woman or another transgender person? That was not said in that video. Because you see all types of relationships with people who are transgender. Could be a man turning into a woman, but yet he's dating a woman. So I wonder, who is her partner and how do they identify themselves? It's a very interesting topic. And will it, like I said, be the next subject matter to go before the Supreme Court as well? No, we're not in agreement with this. Because when you hear the doctors talking in Jazz's situation, they weren't even in agreement on where to cut her. And that was scary to me, because you are expecting your physician, surgeon, to know what he or she is doing. So when you're talking about going under the knife, I want you to be skilled in what you're doing. You heard that one male doctor, he was an Asian doctor. He said, we hadn't done enough for these. What did you just say? You ain't did what? You ain't done 50, or 50's all you've done. That ain't good. I need to see somebody that's done, hell, at least 1,000. With least complications. But then Should I blame the doctor for complications? Because in the end, it is a very drastic procedure. So one could argue, was the surgeon, who was also transgender, knowledgeable in the procedure itself? Did they have enough training to do the surgery? That's first and foremost. How did they find out about the surgeon? Word of mouth? Or did they just go look up on a site? Surgeons in the area doing it? What? Because this one surgeon is saying they ain't done enough of them. So that makes me wonder, well, what is the status of the doctor who's performing the surgery? Did that transgender doctor do a lot of these? And when I mean a lot, I don't mean 50. Like I said, at least 1,000. With least complications. How about that? Thank you for joining me. Whew. I don't know where my mod is. She's like, she didn't answer earlier. She didn't respond. So I'm wondering where she is. This has been an interesting afternoon, I must say. This is a very interesting topic. There's a few of you listening, 23, not many. That's fine. How do you all feel about this surgery? Should it even happen for grown people? Are you going to join us or no, ma'am?
I'm sorry, I was making my meatloaf.
Oh, Lord. What you making some heavy? It's hot as hell outside. You up here making heavy meatloaf. Girl, I'm through with you.
I have my air conditioning on.
Y'all getting ready. Y'all, you gonna make sure that food stick to somebody good. Do you have something you'd like to say pertaining to this subject matter?
Well, mine comes.
And first, let me ask the ultimate question, which is the title of the video. Should it be legal?
After a certain age, and it should not be covered by insurance.
Okay, what age should it start the surgery, ma'am?
Definitely after 21.
Wow, not even 18? Not even 18? Why? Why? Tell me why.
Because I look at my children, 19 and 22. Yes, these kids, you know, they are young adults, right? Just because they live on their own, just because they have good jobs, that does not mean they're mentally mature enough to process all this type of stuff. That's something that is lifelong. This is not something that can be reversed.
Okay. Which we know that. And which these people who decide to get it done, even if somebody decides to pay for their child, they should know once it's been done, you can't go back.
Yeah, and I understand that they go through like a psych evaluation and whatnot, but is it really that intense of a psych evaluation?
Yeah.
I mean,
well, but see, let's go there. What's intense? So what is considered intense? What would be the criteria for it to be intense?
I'm talking, let's just say, more than a year's worth of services. Randomly, maybe once a month, check in on them mentally, see if their mindset is the same.
Oh,
I don't mean like weekly, going in and sitting in the chair or the couch for an hour still in your life. No. But they should be checked on or checked in on, for about 6 months to a year.
Okay.
Just to see what their mindset is like.
Okay. Annette says 18 and older, huge decision. Kathleen says no, not in God's plan.
And I agree with that also. Like that's not in God's plan. Also,
Do you think God, he said, it is said in the scripture, if you believe in God in the Bible, that he's a forgiving God. Would he forgive this, a surgery? Because it's one thing to say, I like the same sex, I want to be involved with the same sex. Is God forgiving of you mutilating your body to emulate the opposite sex? We don't know because we don't talk to God. He won't answer, but you understand what I'm saying. Would he be angry?
Oh, yeah. Yeah, I think it all depends on how you portray God. Like, what is what is that person's religious beliefs?
Yeah.
Like, do they practice religion?
Yeah. But does that even matter? Does that really have anything to do with what God feels? I may actually think I'm a Christian and I'm doing right, but that doesn't mean he thinks I'm doing right or that I'm genuine in my attitude and my disposition. So God may say, I ain't really caring what you're talking about. What is you doing cutting that penis down like that?
Exactly.
I gave that to you. Look, I gave that to you. What is you doing with that? Why are you doing that to what I gave you?
Yeah, you can definitely look at it that way also. I look at it, being in the medical field, I look at it from like the insurance portion of it. And I probably shouldn't, but I don't even, to tell you the truth, I don't even know if insurance covers that.
T says 18 and over. Yeah, two in the chat say 18 and over. Yeah, I was going to bring you all some commentary pertaining to a law passed pertaining to medical insurance and all that. Let me get off here with you for just a second, and I'm going to read you this, and then I'm going to ring you back for just a minute. Okay. Bye-bye. All right, that's KM, my mod. Didn't mean to disrupt that, but there was some information I didn't bring you all, and I'm going to read you all this said commentary pertaining to medical insurance and sexual reassignment in children. Thank you all so much for joining me. I'm so glad you all tuned in to this said information. God bless all of you. This is by the New York Post, if you need verification for the information. Ex-trans teen supports Florida rule blocking funding for medical interventions. This was uploaded July 11th. A California teen who formerly identified as transgender is backing a Florida rule blocking Medicaid funds from paying for medical interventions for gender dysphoria, emotionally telling a hearing that she didn't understand the ramifications and may now be at increased risk for some cancers. Chloe Cole, who decided she was transgender at 12 and underwent a double mastectomy 3 years later, spoke at a public hearing Friday in favor of Rule 59G 1.050, which would restrict Medicaid funding for transgender drugs and procedures. I really didn't understand all of the ramifications of any of the medical decisions that I was making, Cole, now 17, said at the hearing, according to Fox News. I was unknowingly physically cutting off my true self from my body irreversibly and painfully. Cole also spelled out the impact of her decision made as a minor in a separate meeting with Florida Surgeon General Joseph Ladapo, who posted video of her compelling account on Twitter. I don't know if I'll be able to fully carry a child, and I might be at increased risk for certain cancers, mainly cervical cancer, Cole said. And because I do not have my breasts, I no longer have breasts. I'm not able to breastfeed whatever future children I have. Okay, Cole then took a long pause. The footage shows. That realization actually was one of the biggest things that led me to realizing that this was not the path that I should have taken, Cole said, adding that no child should have to experience what she endured. Do not transition your kids, Cole told Fox News when asked what she would tell the public after her experience. If you're considering transitioning, please wait until you are a fully developed adult. Transitioning can damage your body and mind in ways that we may not fully understand. Okay. Ladapo tweeted Sunday that Florida doesn't support the medicalization of minors with gender dysphoria since the benefits are unproven. He thanked Cole for being courageous enough to share her account. Medicalization of minors with gender dysphoria might advance the political views of physicians involved in their care, but the data showing any benefits for the actual children is extraordinarily thin. Ladapo told Fox News the affirmation model runs an unacceptably high risk of harm. However, some published studies have shown benefits of gender-affirming medical interventions, including lower odds of depression and suicide. These data add to existing evidence suggesting that gender-affirming care may be associated with improving well-being among transgender and non-binary use over a short period, which is important given mental health disparities experienced by this population, particularly the high levels of self-harm and suicide, read the February study published in the National Library of Medicine. Another study found that retransitions are rare. Just 7.3% of youth had retransitioned at least once 5 years after their initial social transition, according to the research published in May by the American Academy of Pediatrics. Social transition refers to the process by which trans children or teens adopt the name, pronouns and gender expression, such as clothing, haircuts that match their gender identity. In addition, the vast majority, 94%, identified as binary transgender at the end of the 5-year period, compared to 2.5% who identified as cisgender. These results suggest that retransitions are infrequent, the study concluded. More commonly, transgender youth who socially transition at early ages continue to identify that way. Nonetheless, understanding retransitions is crucial for clinicians and families to help make them as smooth as possible for you. Still, Cole said she supports the Rule 59G 1.50, which would restrict Medicaid funding for transgender drugs, procedures, including puberty blockers, hormone antagonists, sex reassignment surgeries, or other procedures that alter primary or secondary sexual characteristics. Very interesting information. We cannot allow this to happen to children, she replied to Latipo on Twitter. People in power have allowed this to happen. I know you will help break this vicious cycle. Now, mind you, this is commentary from a person who got the surgery and is now trying to go back, whatever that means. Cole's testimony was hailed as very thought-provoking by a spokesperson for Florida's Agency for Healthcare Administration, which recently found several services for treating gender dysphoria aren't consistent with widely accepted professional standards and have the potential for long-term negative effects, Fox News reported. Interesting. The American Academy of Pediatrics and the National Center for Transgender Equality did not respond to requests for comment to Cole's testimony, according to the report. President Biden signed an executive order last month urging the Department of Health and Human Services to ensure minors have access to transgender interventions, but doctors remain split on the issue. And you also see a picture of what is believed to be a female with a flat chest and a purse, bangs, and 2 pigtails in the said photograph. I think the data on which the gender affirmative model is based is not scientific, Dr. Matthew Benson, an endocrinologist in Jacksonville, told Fox News. We need better data. We need long-term prospective trials where we can look at adverse effects. We need much more robust data to justify these kinds of very robust therapies. Cole, meanwhile, previously told the Post she believes she was failed by the system and now refuses to stay quiet. She wants to have children one day, but isn't sure that's going to be a part of her future since the viability of her eggs was compromised by testosterone injections. I'm still in the dark about the overall picture of my health right now, she told the Post last month. So assumingly this was a girl child wanting to be a boy, took testosterones, and now at 17, it's not happy with the results of cutting off the breast because now she wants to have children down the road and realizes that if indeed she is to get pregnant, if she can get pregnant, how will she be able to breastfeed? So isn't that interesting that at 17, she now has regrets of getting her breasts cut off and is dressing feminine? Stay woke. And we've learned this with children. Young children, young adults, that how you start isn't always how you finish, that you could start out being tomboyish, which is a label given to, females that mimic boy behavior, but somewhere down the road, rather through school, high school, whatever, they dated boys, liked boys, but also were attracted to girls. And you've seen women who were as masculine, tomboyish in school, but still dated men, liked men, had babies with men, and or were attracted to women, relations with women, either stayed with a man and or dibble-dabbled with females. And that's something we've learned with women experimenting with same-sex women. Maybe attracted to her or somebody made a pass. You went with the flow, but you desire men and still date men. And some people are bisexual. They are attracted to both sexes, physically and sexually. And they have not changed their identity, either physical and or sexually. How much does it cost to get a surgery? How about that? And the thought of anything costing near $1 million, there's no way in hell somebody could charge near $1 million for a surgery. I can't see a surgery costing $500,000. No way in hell I would let somebody cut on me for $500,000. I don't care how I was feeling. And now you see there's a lot of ramifications for the male to be transformed into a woman. I don't hear many stories of the women trying to get a penis because I think they know physiology. They can't even get the female organ to resemble a penis. Lord have mercy. Help me. Let me Google something for just a second. The cost of reassignment surgery. Gender reassignment surgeries are expensive. Bottom surgeries can cost about $25,000 and top breast surgeries from $7,800 to $10,000. Facial and body contouring are also costly. More employer insurance policies and those sold under the Affordable Care Act now cover at least some gender reassignment surgeries. Well, as you heard in this commentary I just read you, Florida is now saying no Medicaid funds for children getting the surgeries, period. So bottom surgeries are considered your bottom part of your body, which is the male woman organ, can cost about $25,000. And top is your breast surgeries, ranging from $7,800 to $10,000. That's that information in the Google search. Amen. God bless all of you. If you'd like to donate to the channel, $BigAngie129 Cash App. All stickers, chats are welcome during this live. Let me speak to anyone would like to give their commentary pertaining to the said matter. The link is in the chat. Please hit the link. Lord Jesus. I don't know what to say. If you'd like to hit the link, Tracy Joe, hit the link. Hello, how are you?
I'm just over here whipping up my chocolate cake.
Girl, y'all must want to be fat over there where you at. Good Lord. You cooking food like it's winter time. You know this is the season for cold cuts.
We are having meatloaf.
What?
Meatloaf, mashed potatoes.
Macaroni and cheese?
Not fat today.
Okay. Everybody fat. Everybody in your house gonna be laying on the sofa glued together. Golly, I'm just messing. Okay, so I gave you the rundown of the surgeries. $25,000 for the bottom. That's what they call bottom. That's a lot of money, 25 G's, and that's not including, like they say, the other things that go along, such as what that Jenner person was doing with the contouring, the throat shaving. That's money, and it adds up. Yeah. TZ, would you like to give your commentary pertaining to the subject matter? Hit the link, dear. Anybody else in the chat, you are welcome. Any outsiders listening in that have not commented during this chat, feel free to hit the link to give your opinion pertaining to reassignment surgery. Should it be legal, period, for children and or adults? Thank you for joining me. Go ahead.
I think that they need to have extensive evaluation just to make sure that that's something that they're ready for mentally.
Well, how long? How long should this go on, this mental evaluation?
6 months to a year.
6 months to a year, okay.
And they need to pay for it themselves. And they need to pay for all the hormones that go along with it.
Oh, wow. So you want somebody to come out of pocket for a surgery. That's going to be a mean payment plan. That's going to be a mean payment plan.
That ain't my problem. You want to change your sex, you need to come out of your pocket.
Look, $5 foot long. How you can I put $5 down on the surgery? It's a bad joke, but you know what I mean. Yep. What would be the minimum payment for a payment plan? $25,000. $2,500, 10%.
Look, there is so many people that need medication for life-altering things like cancers, leukemia.
You ain't coming here with all that. I don't have that nonsense.
Very expensive things that some insurance plans not cover.
Mm-hmm.
Why should we be covering someone to whack off their bottom part or insert a bottom part, but we can't cover?
Girl, please stop.
You know, Susie Mae's, you know.
I can't. Susie Mae. Are you stealing some of Angela's terminologies? This is a house that Jack built. No, it was Jane, I think. Shut your mouth, man. Ooh. These last $2. These last $2. I'm not gonna lose.
Maybe we just need to ask Judge Judy what she thinks.
Meet me at the casino. Girl, if you don't stop, please. What would Judge Judy have to say? Please enlighten me.
Can you imagine
I
what
can't.
Judge Judy would have to say?
A whole lot of something.
She has no filter.
She does not. That's a spicy little short woman if I ever see it.
Yeah,
Woo.
she is. Full of spice.
Golly. Oh Lord. So you don't believe in the Medicaid paying for it. What about people's jobs, such as people who work, have benefits? Do you believe their medical company should pay for the reassignment and they're grown?
No.
Wow. Dang, you get jiggy with it, ain't you?
No, we're not covering that.
Okay, but that's their money. That's their insurance. They're paying their own insurance.
Okay, so for instance.
That's not Medicaid. Medicaid is state. Your own insurance that you pay in every month with your own money. Why can't they the medical companies go ahead and pay for it and they pay their deductible or however it works?
Okay, so let's say I have Aetna, right? And I have the most expensive tier.
Annette,
right?
you're entitled to your opinion. Everybody has a difference of opinion pertaining to subject matter. You are respectful in your commentary. Thank you very much, dear. Oh, now what you got to say about Aetna?
Okay, so I'm just hypothetically saying.
Okay.
I have Aetna, right?
Mm-hmm.
I go to work every day and I pay for the most expensive premium.
Mm-hmm.
If my job has to offer
Mm-hmm.
through Aetna.
Mm-hmm.
Okay, let's say that one of my kids has, I don't know, some form of a rare genetic defect, and they need life-saving medication on the daily for their heart.
Okay.
And my insurance doesn't cover that.
Okay.
And I'm gonna have to pay $1,500 a month for that.
Okay.
On top of the $1,000 that I pay in a premium a month. Like they're gonna pay for my neighbor to have their body parts reassigned. Like that's a choice.
But it's not about your neighbor. This is about your own insurance paying for your personal changing of the body parts, ma'am.
No. Changing your body parts.
So what are you disagreeing with? Because this we're not talking about Medicaid. We're talking about your own personal insurance. Your own personal insurance says, listen, your own personal insurance says, yes, we will pay. You're saying you have a problem with your personal medical insurance paying. Is that what you're saying?
Yes, I do.
Why?
Yes.
Why?
Coverage is very expensive.
Okay, but what difference do it make? You're not paying for Pookie's. Let's say you're paying for yourself. So what do you have a problem with Pookie wanting to get it done?
I'm talking about the coverage in a whole. I'm not talking about if I needed it. I'm talking about coverage in a whole. That should not be something that should be covered, is what I'm saying.
So, but tell me why. You're not telling me why.
Because that is a choice. That is not a life-saving mechanism.
So, are you trying to say that this premium that whatever the person would have to pay to get the surgery is going to affect insurance rates? Is that where you're going with this? I'm trying to understand what you're saying. Well, say that then, damn it. I'm trying to pull a turnip from you. my back hurts. I might be getting irritable.
Just like people that go, and they get in all these car accidents because they're ambulance chasers or they're looking for a check.
Well,
all of that.
Look, I need to fall in front of one.
That causes our premiums to go up, and it's all done by zip code.
Okay.
I have an outstanding driving record, but because of the zip code that I live in, my premium just went up $20 a month.
Well, everything's gone up too because of the economy itself, dear. You know that.
Oh, I know that, but no.
Yeah.
Coverage should not be paying.
So you're trying to say with these people getting a surgery, it's going to affect your premium, even though it ain't got nothing to do with you. So, so you're saying that on this live that you think people wanting a surgery that
I'm in the medical field.
okay. So that's why I want. So you're speaking from a medical a receipt. You know, Angela's gonna say a receipt.
It is very expensive. Like, okay, let's just say women or men.
Hey, Olivia.
Or young, or actually, I'm not going to say a child. So anybody that is of legal age, 18 or older, that needs to have gastric bypass, right?
Yes. Mm-hmm.
Or a sleeve, or whatever to help them lose the weight. Most of these insurance companies have clauses, because I know mine does, and they do not cover no form of bariatric surgery.
Okay.
Doesn't matter if it's life or death.
Do you agree? Do you agree with it?
Me, when it comes to like that whole aspect of most people become obese or morbidly.
That's not what I asked you. That's not what I asked you, girl. I said, do you think it's right for the company to not pay the damn for the surgery? Now don't start, girl.
I don't think that they should either.
Well, that's all you have to say.
Because we cause ourselves to be fat.
Okay, so because I keep eating and eating, I should not go to my insurance company and say, help me stop eating. It's what you're saying.
Well, they're going to tell you.
Well, the doctor's going to tell you that anyway. Look, the doctor's going to tell you that whether you decide you want to go try to get it, the surgery or not. He's going to tell you, well, you need to cut back on your carbs and what you're eating or you're drinking or whatever. I got TZ up here. TZ, what do you have to say about should it be legal or illegal? Surgery done.
I think it should be illegal for like kids that are underage. I don't think anybody under the age of 18 should be
under 18. Surgery. Okay, tell me why.
Simply because they really don't know their bodies.
Okay.
Like they really don't know their bodies. And like you said, they could change their mind with the blow of the wind.
Right.
So, I don't think the whole top and bottom surgery, I don't think that should be allowed. But like
wait, slow down. I can't. Let me turn my volume down because I can't hear you good. Let's say that again.
If they're wanting to do like counseling and stuff while they're under the age, then yes, by all means, go to therapy and stuff.
If you're grown, you say grown?
If they're under the age of 18.
Okay, wait a minute. Listen. You got some background playing. Are you playing something else in the background? Because I hear an echo.
No, but there's an echo.
Yeah, it's an echo.
Let's see. I don't have anything on.
You don't have the TV on? Do you have the TV on?
It's on, but it's muted.
Okay.
Like I don't even have the volume on.
Myself.
Is it still echoing?
Yeah, I can hear myself when I speak.
Okay, hold on. Give me 1 minute.
Okay, that's fine. Thank you all for joining me. Hello, Olivia. Hello, everybody. Thanks for joining me. What an evening. Well, I guess she's trying to work something out. It's just strange when you come up on the live. It's just very weird how you get feedback on here. Especially when you call on the phone or sometimes laptop. Sometimes the laptop it doesn't go well either. Talking through the laptop.
Yeah, sometimes it's super echoey and other times it's perfectly fine.
Yeah. I've heard so many different things in the background. Buzzing noises, And it's just like, wow, it's very interesting. This computer age. Wi-Fi. Whoever knew that we'd be using that word, Wi-Fi? What the hell is that?
Right?
The older people like, I don't know about a damn Wi-Fi. I still can't work the VRC. Remember that back in the day, they couldn't even work the VCR. I was like, oh man, what you gonna do with a cell phone? All right, T, you're back. Okay, so you said for under the age of 18, you think it's okay for a person to get a surgery for their child under the 18 or no?
No surgeries under the age of 18.
Okay. Over 18?
Over 18, yes.
Okay. What about this medical situation that Kinsley's talking about? Do you feel like Medicaid should pay for people to get hormone treatments and all those things that go along with transitioning and plus the surgery?
If it's covered, then yeah, I feel like they should be able to.
By Medicaid, you think Medicaid should pay?
I guess. I really don't know. I mean, that'd be like me saying, no, you can't do that. And then what about someone that's on Medicaid and needs like the sleeve because they're lose weight?
Let's just stick with the surgery first before we go to the sleeve. We're not really talking about the sleeve, but the medical surgery itself. Y'all, damn. The medical surgery itself, Medicaid possibly pays certain ones. Do you think it should be paying for medical surgeries and I'm about to say damn Botox? I didn't go to bed. hormone treatments and said things.
Not surgeries, but therapy, like counseling.
Oh, counseling. So you think a person should pay out of pocket, no Medicaid payments?
No Medicaid for the top surgery or the bottom.
Okay,
surgery,
no top or bottom by Medicaid. What about a person's personal medical company that they pay their own premium through?
Yeah.
Okay, Kinsley, she also disagrees with both Medicaid and personal for top and bottom surgeries and hormone treatment. Am I saying that correct, Ms. Kinsley?
Absolutely.
But my thing is, it's their personal insurance.
Yeah, I get it, but I look at it from a dollar amount, like what we all pay for premiums.
So you're trying to. So basically, Kinsley trying to say the market. Somebody's determining the fee for all these things you get done, period. And she's basically saying, depending on who wants to mark it up, I'm gonna pay the piper on my insurance regardless, all because of somebody wanting bottom surgery. Is that what you're trying to say? Bottom or top? Kinsley.
Well, yeah, I mean, I just don't think medical insurance should pay for that. That's elective. That's like me going in and needing a nose job. My insurance is not paying for a nose job.
I don't know. You keep saying you keep saying that big boy can't breathe. You know what I'm saying? Just keep saying I can't breathe. Even though let's just say you're lying. Let's just say, listen. Let's say you're lying. Let's say you're lying. No, let's just listen to it. You say you're lying, and you keep telling your doctor, I can't breathe. And it's really you just got a big nozzle. But you say to the doctor, I can't breathe. And maybe he's looking and saying, I don't understand. I don't see nothing. And then he finally just says, here's the name of, Bobby Joe the surgeon. And next thing you know, ting, you got that cute little nose you always wanted.
Yeah, but I don't think that when that happens, like, for instance, you have a deviated septum, right, and you really can't breathe.
Uh-huh.
They're not going to go in. They are not going to go in and reconstruct your nose. They're going to go in and fix what needs to be fixed. They're not going to go in there
and shave the nose down.
No, they're not going to do all that.
But what if I tell my doctor, I think it'd be a little better on my breathing if my nose wasn't so big, and he'd go ahead and say, okay, I'm gonna shave you down and cough you right on up. How about that?
Well, then they're going to, if he subjects himself to altering his medical documents, then there's a chance.
I just knew you was going to get technical.
Yeah.
I just knew she was going to get technical.
That's my forte.
Oh, Lord.
I mean, I know it's not reality. When it comes to insurance, you could pay top-notch premium all you want to, and you still won't be able to use your insurance the way you want. It's up to the insurance company. I get that.
Exactly.
So what I would do though, I would see if I could find insurance that covers cosmetic, what they consider cosmetic or elective surgeries, and then I would go about it that way.
That's a good suggestion. That's a very good suggestion. Just in case you want to get your boob done, tilted to the right, to the left,
exactly,
whatever. Let me go find some insurance that says you pay the right dollar amount. Hell yeah, we're gonna let you get cut off.
Right. You know, and the whole elective surgery and cosmetic surgery is tricky. I don't even like that word because you can have your breast be too large and you need a reduction because of back pain and stuff.
I've had it done. For those
and they can be like, sorry, it's cosmetic.
But let me say, I'm glad you mentioned that because I had it done in 04. February of 04, I had my breast reduced. And it was the best thing that ever happened to me besides sliced bread. Did you hear what I said?
Yeah.
I'm still happy to this day. And even in some of my photos, they look larger, but that's normal because they filled out. Then too, as you gain weight, you know, naturally those boom booms are gonna revitalize themselves. And I told the doctor, let me say, I asked the surgeon, I said, now, I said, what I want to know is, will they get back to the way they were? As big as they were. And he said, honey, the only way your boom booms get back to the way they were is if you were to weigh 500 pounds. That's what he said. 500 pounds. So guess what? We ain't trying to get the 500 pounds to find out how big your boom can get back. Because right now they do look a little full. They look way fuller than they did when I first got the surgery. Well, I can tell you, it was the best decision of my life. I felt better. I could breathe. I could walk, run, hop, skip. I didn't feel, you know, congested with a coat on and a purse on my shoulder, my right shoulder. It was a major difference. I could tell because I made sure to go walk in the mall. I said, I'm going to walk this mall. I'm going to see how I feel. And I could tell the difference that I wasn't out of breath. I wasn't huffing and puffing. Because I could take a shower and come out of the shower and you would think I had been running. I felt like I had been running coming out of a hot shower. I had to literally get out of the shower, sit for a minute just so I could breathe. That's how huge they were. They were big. And they covered my stomach to where now still my stomach looks bigger because my boom booms covered my stomach. So I remember some guy that I had intertwined with many moons ago, and he saw me out one night and he said, oh my God, are you pregnant? And I was so offended. I was so damn offended. I'm just like, wait a minute. I got these damn things cut down to look smaller. This fucker saying I look pregnant. So that lets me know how big my breasts were to where them bad boys were so huge, they were covering my damn stomach. The top portion of my stomach. So the only thing y'all saw was the little bitty pouch that sits above my girlfriend. My little kangaroo pouch. But now I got an onion and a kangaroo pouch. Shut up, Queen. Damn. I'm dead. I'm done too, honey. I need a swig of liquor on that one. I said, damn, is your stomach that big? And I can still see my stomach. It shows because there's no breasts. There's no breasts to cover the stomach. They actually sit up. I don't even have to wear a brassiere if I don't want to. They still sit up like they did when he cut me. And I could honestly say, let's talk about that too. The feeling, such as these people talking about getting the surgeries done, there was no feeling in my breast, nowhere. Around underneath where they cut, up around the nipple, all that, there was no feeling for years. And you know, a lot of men are breast men always talking about, oh, I love a woman's breast, blah, blah, blah. It would have meant nothing for anyone to fondle them because I wouldn't have felt it. I wouldn't have felt it. You understand what I'm saying?
Yeah.
It took years to actually get feeling in my breast, and especially in the nipple area, all that. It's nothing. Still a little numbness in some, but it's nothing like it was at first. The first few years, I had no feeling in my breast. So this is why I said, you can get a surgery for various reasons, and there is no feeling in that area because you are cutting into the flesh, membranes, nerve endings, and all that. So you're cutting into what's naturally flowing before surgery. So afterwards, it's natural for there to be no feelings in that area. Hello, dear. How you doing, Monica? Ooh, y'all got a little bit of tea, didn't you?
Yeah.
But I bet you one thing, ain't nobody getting ready to mess with Sugar Mama. I bet you that. Ain't no cutting down now.
No.
Ain't nothing. It better not be nothing going on down there. This is just something that's, like you say, life-saving. They got to do internally, but just some furniture rearranging. No furniture rearranging. Let's talk about the women side of the coin, because it's always the man transitioning to the woman. I rarely hear of a woman trying to get a penis. I rarely hear any stories of, you know what I'm saying, the ramifications of trying to get the surgery, because most women just don't have enough flesh down there to orchestrate into a penis, even the smallest of a male penis. And I'm sure many of you are living have seen a very small, minute butterbean of a penis. So you imagine there are some men who don't even have a normal sized penis. He might as well be like a girl, because I think many of us have seen a man. He was fleshy. He could be fleshy down there. Let's just say he had a little weight on him. He didn't have a normal sized penis, an average sized penis. So basically, he's got what I would consider a mound and a knob. So the knob is easily just cut off, and they could make a vagina out of his private part. Oh,
okay.
KM, you don't understand what I'm saying? I don't get me testifying up in here. No, I saw something. I saw something a year ago. I was telling my cousin about that earlier. I said, this man didn't have anything. It was baffling to me. How do you don't have a penis? How do you don't have a penis? You don't have a penis. I don't understand. How is it humanly possible you don't have a penis? Because if you saw him, you would have said to yourself, oh my God, he's nice looking. He's handsome, smell good. But baby, underneath all of that was nothing. Absolutely. I know, and I'm not exaggerating when I say nothing. I mean what I'm saying to you, that his body parts could have easily been conformed to a vagina, because the knob wasn't even. I wanted to say, how in the world are you somebody's father? That's how bad it was. Because I'm trying to figure out, you've got to be able to get it erect, right?
Yeah, definitely.
Okay, so a penis has to be able to pass semen erect. So if it ain't much, I think you know the rest. I could never understand. So when he says he had a son, I think you might need to get a DNA, because that might be some other man's baby. I'm gonna stop cutting up. I know, just a little mild humor. Forgive my manners. It's still early. It's too really early for this conversation. But anyway, anything else you want to add with us, T? Go ahead.
I know a few trans men.
I hope he was talented though, right, Queen? Well, that's the only talent he could have, because that thing he didn't have anything at the bottom. So there was nothing left but the you know what. So that's what I thought was strange too, because he didn't want to show his bottom. You get where I'm going? He kept saying, "Oh, it's all about pleasing you." So my mind was like, "Okay, what do you mean? You don't? Why would you not want to do that?" So then it dawned on me, oh, he's talking about the other. So then it's like, okay, what's wrong with this picture here? So then my mind said, damn, he ain't got nothing. And then naturally my hand maneuvered and it found out on its own.
Okay.
So it was like I was with just another fat girl. I was with a real big, pretty, light-skinned girl, 6'6".
Wow.
Kind of like cable. Anyone want to watch TV? Watch TV. We're not going to be doing anything else, so this has become a talking session. You know. Anyway, T, what you got to say?
I was just saying. I know some trans men, which girls that transition into men, but
how? Please enlighten me. How?
I mean, they of course got top surgery, which was the first thing that they did, and then
you mean got the breast cut off?
Yeah.
Okay. That's easy, cutting the tissue off. That's nothing.
Yeah.
I'm talking about conforming a woman's vagina into a penis. How could it possibly?
That I don't know. I have not had the oomph to ask.
I mean,
I just
you know somebody that's had a woman that said she got a man's surgery. Is that what you're saying to me?
They had to do the hysterectomy. Did the full hysterectomy, which would make sure that they did not have a period.
Oh wow.
But I haven't asked about anything else.
So you haven't even asked, can I see it?
No.
So they're going in and taking out the girly parts, but what are they doing with the outside to make it look like a penis?
I don't know, but it's something about something that grows.
Listen, like Keith Sweat, something, right?
It's something. There's something down there that grows and gets longer, but it's not going to be realistically longer.
How could some girl? Wait.
I'm trying to tell you.
Oh God, KM, please stop. What in God's name down there? When I look at what I have, I am trying to visualize what is coming out of there that's going to grow on its own. It ain't grown now.
I just all I know is it involves changing. You're changing the thingy into a penis.
So it's the Matrix.
Yeah. Like I don't know how, but they do something.
Listen, you can do magic. I'm dead. Oh, there it is. Shut up, Queen. You know what? I can't. I want to know what can make it grow. That's it. Time to Google.
I was looking on Google earlier after our last.
I'm getting ready to go on YouTube, since YouTube is the infamous place for knowledge.
It looked like on this picture that I seen on Google that it was somebody's it looked like a index finger.
Okay. Y'all ain't even monitoring the chat with these spams. And then I got my own self laughing. And she up here chopping up stuff.
I'm cutting potatoes, you guys. Sorry.
Oh, you're all right. I'm gonna Google it. I'm gonna put this in the YouTube search. Female vagina. Oh Lord. Turned into penis. And I'm gonna see if I got a picture. Lord, forgive me for what I'm doing. Let's see. Oh God, I'm about to throw up. Oh, honey. Yes, and she's chopping stuff. What in the world? Prosthesis implantation. Professor Dr. Sardar Nasir. What are y'all doing? Oh, honey, this ain't no good. This ain't no good. Looking at my vagina for the first time. No. I don't understand. Oh no. Male to female. I ain't trying to look at that. I'm trying to do female to. Oh, here it is right here. How to gender transfer through surgery, female to male. Okay, hold on a minute. Let me play this for a minute. Shoot. Let me see. Hold on a minute. Hold on, y'all. This surgery animation demonstrates the process. So it's like they make an incision above the vagina. It occurs in stages. This is how it's done. So they must get an implant and insert it inside. See, it's during a double mastectomy. Both breasts are removed. Okay. Wait. Let me finish. The uterus and fallopian tubes are also removed. Wait a minute. Oh, Lord Jesus.
Now,
Genital, listen. Genital transformation procedure are the next stage. Wait 1 second, Cam. I'm trying to get all this out. The urethra is rerouted to allow urination through the phallus. Oh, Lord Jesus. This is crazy. The labia majora form the scrotum. Okay. During a scrotoplasty, synthetic testicles are implanted. A radial forearm flap or an alternate portion of skin is used for penile reconstruction. Oh, Lord Jesus. Finally, hormones alter the amount of testosterone in a person's body. I got to see this. This animation ain't helping. An estimated 100 to 500 people in the U.S. undergo sex reassignment operations each year. Thanks for watching. Let me share this to my channel so y'all can see for yourself. A reanimation. Still not the same as actually seeing the real thing. Okay. I'm trying to find a real picture of what it looks like. I don't want to see male to female. I'm trying to see female to male. I'm just
look on Google. That's right.
See male to female transgender. This looks so gross. World's first male sex doll. Dear God, please help me. Female sexual response. Oh, what is this? Little boy who's raised as a girl at the Oprah Winfrey show. Now this is interesting. How deep should the penis go? Interesting. Oh no, I've wondered that though. It says male to female. Why I can't find female to male? See, everything's about male to woman. Oh my God, if you see this picture I'm looking at, you will pass all the way out. Then they got one with John Hopkins where this woman is standing here with a dildo and an animation of a vagina and the penetration. This has to, I can't, 4 minutes. Introduction to vaginal dilation after vaginoplasty. Oh, Jesus. 7 things I miss about having a penis. Now, that should be interesting. Would you all like to hear that?
Sure, why not?
What about you, T?
No. You can look up on YouTube female to male gender reassignment,
Maybe
and it will show it.
Okay, let me do that. Let me see. Hold on. Female to male gender reassignment surgery.
Mm-hmm.
I can't with her on here. Hold on a minute. See, it won't do it with her chopping. Hold on a minute. Let me call.
I'm done right now.
Okay, hold on. Let me get you off for just 1 second. I'll call you right back.
Okay.
Okay. Because I can't do it with that screen still on. Hold on. Okay. Let me see. Now say it again.
Female to male reassignment surgery.
Well, you said it for me. Here we go. Oh. Oh, Lordy, Lordy, Lordy. Lordy, Lordy, Lordy. Oh, Lord. Thank you. I'm scared to look. Oh, God. Oh, God. Oh, God. Oh, God. I'm going to whoop your ass. Ah! Jeez. Jeez Louise. Oh. Woo! I can't do this.
Mm-hmm.
I can't. I'm gonna share it with y'all. Y'all do what y'all want with it. I can't do this. They're gonna have to show me the afterwards. So I can't look. I can't.
Like it.
Oh, girl, my eyes closed.
Those surgeries are some serious things.
God have mercy. They just got to show me the end result. I can't look.
Mm-mm.
Whew. Yes, I posted it to my community board. Feel free to go on over there. I can't do it. Somebody says those surgeries are very intense. Seen some trans people on YouTube and they had complications. Yeah.
Mm-hmm.
Usually I always hear the complications with the man trying to become a woman. But just looking at what I just saw, for the man or the woman trying to become a man, that's... Let me ask you this, T. Do you think it's worth it? Whether you have complications or not. Let's go there.
See that I really don't know. I really don't know. That's why it's something you have to really make sure that you're wanting to do this.
Yeah, because in your mind, it's like what Jazz was saying, I'm hoping everything goes well. I got a positive attitude about it, which she did. But that's the thing. Once you get cut on and then open your eyes, you now got to wait to see what your body's going to do.
Right, and you have to also make sure that you are mentally prepared for
a worst case
things for something. If something does go wrong, are you going to be able to handle the outcome?
And that girl who I showed, Ruby, I'm trying to picture a penis going inside of the vagina, the newly constructed vagina, because you had problems the first 2 years with swelling and UTIs and all that. Is this reconfiguration going to be able to accommodate the average size penis or bigger? Because she said, well, yeah, it's doing pretty good with the average size penis, but let's talk about the guy who has a very large penis. Would this configuration be able to take it?
See, I don't know. That's something that...
Because that's still not a real vagina. And even a real vagina can have, chafing and, issues with a regular penis that is well endowed. Because every woman is not shaped and built the same. And two, as you get older, which men act like they don't know this, a woman's walls become thinner. So it can be a little more painful taking in a well endowed man.
Mm-hmm.
But the walls are thinner as you age.
Right. But as a woman, if you can't handle a large endowed, then don't get with a large endowed. Does that make sense what I'm saying?
I know, but guess what? When you meet and greet people, you start dating. Let's say you dating somebody for a while and you don't have sex with them. Once you see it naked and then you do that, you're not going to know until he penetrates you.
Right.
So should she say, well, you're too big for me, I can't date you?
Right.
More than likely it'll be she won't want sex as often. And naturally for a man who's very active, that desire sex, that's going to be a problem.
Right. That is true. It will cause an issue in the relationship,
and that's what
or
I'm saying.
even dating.
Problem if you're transgender and you meet a guy and he's a very well endowed guy, and God forbid he penetrates you and something goes terribly wrong, because let's just say you hadn't been with a well endowed guy since you had the surgery. Now you get with this big guy, and what if it starts to do something inside there? Because you got to remember, it's still not a vagina.
Right, and it could possibly cause you to have
Yes,
another
with
surgery.
your urethra and those type of issues in there, the bathroom situation, the bathroom issues. Oh Lord, have mercy. Marie, I need a strong drink. Talking about this. Oh, God Almighty. I'm 2 hours in. Let me see. Go ahead, finish, honey.
But I mean, that was it.
I got to get off of that.
I could never. My thing was, I know one of my friends asked me, said, "Would you ever transition?" And to me, I was just like, the only way I would ever transition is my penis would have to match my ego. And I said, "There's no way I would have a 9-inch." I'm like, it ain't gonna happen.
So you would want a 9-inch? You would want a 9-inch penis?
Yeah.
Why 9 inches? Why not 11? I'm just asking.
I don't know. Something about the 9-inch.
Because that's the number you heard guys bragging about, having a 9-inch penis.
I think it's just because it's the size of my strap.
I'm dead.
So
I'm
ass.
I can't believe you just said that.
And I feel like, okay, that should be a good size. If I'm a fat dude that should be pretty good, just in case I have a belly. Like, that's how you have to work in all that stuff. You don't want a dicky do. You want to have one, a dicky do, where your stomach sticks out more than your dicky do. You don't want that.
Okay.
And that's just how my mind worked. So I'm like, no, it's just not for me. It is not for me. It really isn't.
Well, because you've heard of the complications after the fact, and that they have not been kind to some people.
And I also have seen the outcome of, hey, I have to quit transitioning because of my health, and then I watched my friend go downhill mentally.
Yeah.
You know what I mean? And you're just like, okay, you're going to have to, you got to get your mind right. I think that's why that is something when I talk about it, I always say you have to get your mind right.
But see, that's the thing. A lot of people probably went into it positive until after surgery, and it's time to heal, and things started to go awry, and now the attitude has changed, which that would be anybody. You're hoping a good result, but you're having complications. Maybe eventually, maybe in the beginning, there was a good attitude, a good mentality, positive thought. But I'm not healing up. The sutures are opening. I'm numb. I got UTIs. Woo, woo, woo.
Yeah.
And all these things happening to my body I wasn't anticipating.
But this is something, as a trans woman, which is, the woman that, okay, you need to understand UTIs is something that women deal with.
Yeah. Well, the reason why that transition was getting transgender person was getting that is because you're reconstructing something that one wasn't supposed to be reconstructed. See, because what was it said the erectile tissue was touching the urethra, which was causing the urinary tract infections. But that's because you're doing something to the organ that it wasn't supposed to be done. That's just common sense. You weren't supposed to be in there messing around with that stuff.
I don't know. I'm
just keeping it honest.
Yeah.
You're in there messing with something that was already the way it came in the full package that was designed for your body. You've now gone in there altering what was not designed. So it's expected that there's going to be problems.
Right.
Why not? Hey, Juanita, how you doing? You're in now, as my mama would say, you in there rambling.
Right. Now I have followed a trans man. I follow him on Facebook and stuff, And he's trans man up top, but on bottom, and he will even tell you, I still have mine.
Okay,
you know?
so has he decided to keep the penis and not transform?
No, he decided to keep his vagina.
Huh?
He's decided to keep
it's
his,
a lady.
He's a trans man.
Okay,
Trans
trans man.
men
I'm sorry.
are the
Okay, I got
the
you.
girls
I got you.
transitioning to men.
Okay, trans man. Okay, so female bottom, but male top.
And he actually chose, and he said, "No, I chose to keep it because
Well,
he just didn't want to."
Watched the video I had already seen before when I was trying to do my homework for this article weeks ago. I had watched this video years before, and there was a white guy who had chest cut down, but said, "I'm keeping my bottom as is. I don't want to change anything." Probably scared. It's why. Probably
because
scared.
I mean, and now that he's older, he still tells you, I still don't want to do it.
Wow. How old are we talking?
I think he's in his 50s now, 50s or 60s.
Wow.
Like, because I remember him off, I think, like MTV or something.
Yeah.
And I think that's how he got my attention. I started keeping track of him. And then, he was into the adult industry and stuff. So I was like, okay. And now that he is older, he tries to bring trans awareness and stuff. Some people don't agree with him. Some people do. When it comes, but that's something I realized when it comes to being trans, not everybody wants the bottoms changed.
Okay.
They're okay with the bottom and they change their tops.
Okay.
It just really depends on the persons. Then there's some that just like, no, I want complete, and they do the complete. But it's not, I think having trans or transitioning is not for the weak. I really don't. Because of like we were talking about surgery incidents, you got to have your mind right.
Yeah.
Your life when you transition, especially trans women, which is the men transitioning to women, their lives are at stake higher than what one might think. And it's nothing to lose your life as a trans woman. It really isn't. So I mean, that's the little things that I've realized and have found out just by having trans friends and wanting to know what they have to deal with. Do you know what I mean? So I don't know. But I don't think children should have that decision. I don't think they need to be the ones that decide that they want to do it. That's all I know.
Okay. So, you like where you are right now?
Oh yeah. But I will admit there was a time where I didn't like my breasts. I didn't, and I don't know why. But at one time, especially whenever I had found out about my cancer, well, my breast left because I lost so much weight.
Right.
And I felt some kind of way about being almost flat chested, like I was flat chest. So I was like, oh, I like how I'm looking in these tank tops and stuff. But then when I started my chemo treatments and I started gaining my weight, and I looked down and I'm like, ooh, I got boobs. I was happy about my boobs. So it's like, it just depended. But I do know for a fact that I could not. I know I can't transition.
Okay.
It's just something I know I couldn't do, and I know that I'm a woman. Does that make sense?
Yeah. So you do have breasts still now?
Oh yeah, yeah.
But they're not as big, or
they've gotten bigger because I've gained more weight.
Okay,
so,
I got you.
They're bigger than what they were in 2012 when I found out.
Okay, so you're content with the size of your breasts now?
Mm-hmm.
You're going to keep your breasts. You don't plan on taking them off?
No, I love my knocks. I
Do
ain't
you
taking them
really?
off. Yeah, I love them. I love them.
That's so funny.
Because I can look down and be like, oh, look at y'all. You know what I mean? Like,
Oh, okay.
oh,
So you said you proud to have them.
I'm proud to have them. I'm proud to have them. But that goes to show you can change your mind.
And that's the thing about life. What I said the other day in my live, how I talk and feel about something today doesn't mean I can't change my mind tomorrow.
Exactly. Yep.
And I think we think that when people are adamant about something, well, they feel like this, they ain't gonna think this way tomorrow. Well, everybody's entitled to change his or her opinion of something. And I can honestly say, I like my boom booms.
Yes.
I love her. I didn't like them before when they were, heavy, and then, naturally they were saggy because they were big. But over the years, after the surgery and getting them sized down, they have become my best friends. They're gorgeous. I like it.
See, that's
Listen,
how
I
I
like
felt.
a she and she.
Yes, that's how I'll never forget it. They were like, hey, they were like, T, we got to access your port. And I had took off my t-shirt and I had a wife beater on. And I'll never forget, I looked down and they were just like, boom, check us out. And that's what came out of my mouth was, oh my gosh, I got boobs again,
Okay. Isn't that interesting how your mind changed?
It is. It is. And it was just.
Do you think it's that your mindset was different at the time when you didn't want the boobs? Could that be it?
I think that's what it was. I think I just didn't want my boobs.
Okay.
And it's weird. Some of my lesbian friends, they're like, I can go without my boobs and not care.
I think because if you're identifying with the opposite sex, it would be understandable you don't want the boobs because that's not something that is masculine, is having boobs. Now, we have seen man boobs, and I can honestly say that is not attractive to the queen. It's no disrespect because I'm a big girl, but I'm expected to have some fatty parts. Do you understand? Because I'm a female. But on a man, they're just not attractive because you're used to seeing a flat-chested man. Whether he's hairy, not hairy, but that is what is the identification of a man, is a flat chest, not fatty chest. But that means if you gain weight or you're heavy and you're a guy, your chest is going to resemble that of a female. That's just common sense.
Right.
And I can just honestly say that I don't want to look at a guy that looks like me naked. I'm serious. I have a phobia. It's not to say that I've never been in my younger days with a guy that's had weight on him or whatever, but I don't want to look at any guy that looks like me without his clothes on. It trips me out. Because it's like, okay, I feel like I am with a woman.
Right.
And then God forbid he ain't got no thing. Then it's like,
oh yeah,
I'm just not really going to be able to engage him the way I want to physically, even though he could be a really nice guy, he could be handsome, but everything is resembling me.
Right.
So it's like I'm lying with a woman, even though he has a male part, but I'm looking at all this fatty tissue, fatty chest, fatty stomach. Down there's fatty, and then maybe not conducive to a nice size male organ. So it's like, man, this is going to be work. And I can tell you about the queen. I'm very finicky about certain things, not to get descriptive in the live, but I don't want to be sweaty, hot. I know some people are like, what? But I don't. I don't like perspiring. And I don't want a sweaty person on top of me. You can even be a thin guy. I hate sweat.
I get what you're saying.
I hate perspiration. Yeah. I don't want to sweat myself. And I don't want anything above me, beside me, sloughing off sweat. I know it sounds horrible, but I don't. And then if you a big old man and you all on top of Queen is about to just say, oh, I'm so tired because I just don't want nothing crushing eye. See, the guys like a woman with a little something on her. Be it a hip, a butt, breast, a little stomach, thigh, because that's expected of a woman. A big old man, that's just not. I ain't turned on.
Okay, so when you
I'm
say
not
big
turned
old
on by a
man,
big guy.
like when you said big guys, are you talking about like the dad bods?
You know what?
Are you talking about like Bone
I
Crusher
like
Rick
I
Ross?
just like either he's well built, muscular, or he's average size and muscular, or he's thin, muscular.
Gotcha. Okay. Now
Like
I'm
what I'm
understanding.
used to seeing, what I'm attracted to, the person I've been attracted to, he's very lean. He
Yeah.
doesn't have any body fat. The boy is
Gotcha.
just beautiful. You understand what I'm saying? Just a beautiful ass black man. And that's what my eyes have now gotten accustomed to. So I can't even picture myself, even a guy with a little bit of fat on him. I can't.
Okay.
Because even now when I'm out and I see a guy in his clothes, you know, I think of that person and I'm thinking, he ain't got no body fat. You know what I'm saying? And if I see a guy that's got even a love handle, I'm like, damn.
Okay. Now I'm understanding.
Him got a little fat on him. Even though I'm a big woman, you understand what I'm saying? But it's what my eyes have gotten accustomed to, and being around, I'm attracted to this person. I'm attracted to how he looks, and he's a thinner person. And he doesn't have, I mean, I'm talking no fat. No fat. And it's just
He's
like,
pure
God.
lean.
He's older, he's a little older, and I'm just like, you know, how did you go this long in life? You don't have like no body fat, not even you don't have a beer gut or nothing. But obviously he has a high metabolism. That's just his chemical makeup. He's not a big person.
Right.
Juanita says, I don't want man bigger boobs or prettier than I. You know what I'm doing. Now wait a damn minute. He can't be pretty, Juanita. You don't want a pretty Ricky. Listen, she don't want a pretty Ricky.
She said no.
Oh yeah, because if your ass in that mirror longer than Queen, we gonna have a problem. Hey, you hear me? See, I like that dude that go. He takes a shower, he bathe, throw his clothes on, he looking at Queen like, Queen, when you gonna get ready? Queen, when you gonna get ready? Because that's me though. He did the basics. You know, he ain't in there trying to groom nothing.
Yeah.
Like he get ready to go to a damn fashion show. But you do have some men who are into the grooming process, and it doesn't mean that they are gay or bisexual. They just are meticulous about their looks.
Yeah, that's like what do they call them? Well, they're silver foxes. They're the older black men with the gray and the beards.
Boys.
You know what I'm talking about?
Salt and pepper hair or something like that.
Yeah, salt and pepper hair. They got a little gray in their beard. They wear their hats. They suited.
Yeah. See, I love a well-dressed man. I really do. I would prefer a well-dressed man. I have yet to meet a man that's tickled my fancy that, you know, wore loafers and you know, the Argyle sweater. Oh, that's a turn on for the Queen. I really don't care for tennis shoes, gym shoes, jeans, t-shirts. I really don't care for that look. I just don't. I hate to say it. I like a guy in a skinny jean because I think a certain type of man can pull off a skinny jean, and he's all day masculine and assertive and secure with himself. Because I don't identify the skinny jean with a gay man. You understand what I'm saying? I think it's a secure man that can say, I can pull these damn jeans up and button them at the waist, and I ain't got no muffin top or nothing.
See, that's the thing.
And I'm a straight
the
man.
whole baggy pants thing. I have never understood that.
Well, you know, everything starts with the fashion. So that started with a fashion back in the 90s, and it got out of control to where the young guys thought it was okay to let their undergarments show, which is nasty. And they said that really started in prison to let another man know that he is that way.
Right. Like to the point where you thinking you might as well just take your pants off.
But it's nasty. To me, it's nasty. To have your underwear showing. To me, it's no different than a woman. A lot of guys back in the day thought that was cute, seeing a woman with her thong hanging out, and then her jeans are too tight, shorts are too tight, and they're hanging off her ass, and you see her thong. To a guy, that was enticing, but it's still nasty because it's just showing that you ain't wearing full undergarments and you're letting your ass crack show. I don't know how that's. So to me, the guy is the same thing. I don't want to see your boxers, and God forbid you ain't white well and you walking around with your jeans hanging, and folks see that you got stripes in your drawers.
Damn.
Now, who gonna tell you, man, you need to put your pants up, you ain't wiped your ass.
Right.
You understand what I'm saying?
Yeah.
It's just it's an ugly look. I like a guy in jeans, but I do believe you can wear regular jeans from the department store without them sagging, and you still will look good in the jeans.
Yeah. Yeah.
I don't care if they're stone washed, they got tears in them, they're dark denim. Wear the jeans with a damn belt, shirt tucked in or shirt out, whichsoever. But the saggy jeans, that is just an unglorified look. I don't like it. I ain't never been turned on by no saggy jeans.
No, I've never thought that was.
I see men in jeans all the time, and they've got their belt on with them or whatever, and they look good with their jeans, and they're not sagging, and they're modern looking jeans. They're stylish jeans. They're just not hanging off their butt. And I don't. It's a turnoff for me. To me, that shows me you don't care about yourself, and you're not going anywhere, because there's no reason for you to be walking around with your jeans hanging almost to your damn mid thigh.
Right.
And I've seen them sagging with a belt, and the jean is hanging off their ass cheeks, and there's a belt looped into the jeans. So it's like, wait a minute, you're wearing sagging jeans with a belt?
Well, what's the purpose of wearing a belt?
I don't know. I don't know.
No.
Yes, Smoky Mountain, I do need a man with a little class. I have yet to meet one that I'm just like enthralled with, that's got everything that I want. Because usually what we desire is what we don't want and need. But I love a well-dressed man. I love a man that keeps his hair cut. If he wears dreadlocks, he's got them tightened and they're neat. You understand what I'm saying?
Dreads got to be tight. Yeah.
He's neat in appearance. I don't like that scraggly, broke off dreadlock look. I don't like that. I've also been attracted to men with the beard. I never liked facial hair, but I've seen a lot of men with the beard, and it was neatly cut. And I was like, wow, he really is handsome, with the beard. And I've never been into facial hair. Never been into facial hair.
I don't know, but I have got to get off here. I got to call my sister. She's called twice.
That's fine. I'm going to end this live because I'm 2:27, because I'm going to come back on later tonight when it's, the witching hour. And we're going to, I don't know if you're going to be up or not, if you have to go to work in the morning. But I was going to talk about the childish man.
All right. Hopefully I'll be on, or I'll be up.
Yeah, the next live will be about the guy who won't grow up. This is the guy who's still getting in trouble with the law, breaking the law, still not holding his weight in the world. He may work, but he's still lacking discipline, still throwing tantrums, still just has not made it to adulthood.
Okay. Yeah, I'll try and make it.
Yeah, it's going to be a matter of, should a woman wait on him, see if he'll change, or keep it moving?
Right. Okay. All right, then.
Thank you, babe.
All right. Thank you.
Okay. All right. Bye-bye.
Bye.
TCB, my other mod. Thank you all so much. I had 2 mods joining me in this live conversation. Please go to my community board to see the transformation of a female body organ turned into a male. It looks pretty gruesome. I will probably watch it later when I have fully digested all of my food. I thank you all so much for following the content. I've been meaning to get this content out for over a month now. This is a part of my transgender homosexuality series. When I come up with another topic, I will bring it to you. But should it be legal? Reassignment surgery. You hear commentary from one of the mods that private insurance shouldn't pay for it, nor should Medicaid. I brought you an article pertaining to a young woman who says she made a grave mistake by cutting off her breasts, young age. Now she misses them, wants them back because she now wants to have children one day. So at one time, perhaps she was feeling masculine in herself, but maybe no longer that now. And that's the reason why perhaps parents shouldn't pay for reassignment surgery for children, because one, they're not fully grown. Their mind isn't fully grown not mature. They haven't lived long enough to see how they actually want to navigate in the world. Okay? They haven't lived to say they want to be in the body they're in or change their sex or be bisexual, perhaps. That's why it's best to not do anything to the body under the age of 18, perhaps even 21. So should sex assignment reassignment be legal in this country, either for children and or adults? Should Medicaid continue to pay for sexual hormones and reassignment? And also private insurances. My mods gave their opinion on both of the said commentary. Thank you so much, Smokey. Thank you so much. I appreciate that. I'm glad the few tuned in. Thank you all so much for following this content. Any information thereafter, I've posted to my community board, such as the surgery of a woman transforming into a man. If your stomach can stomach it, please go over to my community post. It's there. I made a live earlier pertaining to Summer Wells. Core TV gave information and had a panel of guests on there with Vinnie Politan. That was the earlier live number 1. This is live number 2. And my third live before the witching hour will be childish men. That subject matter will be about men who have not grown up. They've not made a way for themselves, either mentally, physically, financially, verbally. They still act like children, behave like children. Don't know how to act, don't know how to talk. Wishy-washy, flighty, don't hold their weight, mislead you, misleading women. Not staying on board to do the right thing, to do right by the said women. We're going to talk about that, the childish man. When is he going to grow up and act like an adult, behave like an adult? Because the one thing you have to tell yourself in meeting and greeting people, liking people, that rarely do people change, especially when they're older. And when you're dealing with people who are at least 40, you have to ask yourself, what is it about him or her that's going to change? I like this about him, but I don't like this about him, her. Are they willing to change? And if you call them out on their misgivings, are they willing to own it? Yeah, I'm childish in this area. I'm irresponsible in this area. Yeah, I'm willing to work on that. Or is it, hey, I don't give a F. It's none of your business. I'm doing what I want to do. I live how I want to live. You either like me for who I am or don't fool with me at all. And sometimes you have to take the latter and say, well, I don't need to fool with you because you need to grow up. Because the negatives outweigh the positive. And I think most of us have seen that in men, that the thing that starts out good ends up terribly, terribly wrong. And you realize you've been dealing with a child. You've been dealing with a full-bodied child who refuses to grow up. That's my third live for the evening. If you'd like to donate to the channel and the dream of everyday shenanigans, $McAngie 129 Cash App. All stickers and chats are welcome during my lives. Thank you all so much for following the content. God bless all of you. Hope you had a good weekend. It's the start of a new week. I will post a movie of the week to the community board. This is Everyday Shenanigans. Thanks for joining me.